Hi Riley, I'm Alexa. I'm going to be the nurse going over your discharge teaching with you for you and your newborn today before you guys go home. Going over diet first. Adequate nutrition is good for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Drink plenty of water and non-sugared supplemental juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. You should gradually increase your daily activities until you're back to your normal routine. Rest frequently, no lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you're released by your physician. Your breasts and nipples may have changed and or grown in size during your pregnancy. Wear a well-fitted, supportive bra each day and night, as it may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. If you're not breastfeeding, wear a well-fitted, supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of frozen wet towel, cold packs, or ice packs for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. Some breastfeeding tips for you. Your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lip and your breast to break the suction gently. Reposition and try again. How long should you nurse? As long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though not for very long. It's important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing would include hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, the ears may even wiggle, and not seeing dimples in your baby's cheek. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple but no pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. I'll get more of your snacks here. Hygiene tips. Wash your hands frequently as you're caring for yourself to prevent infection. You also want to wipe front to back after going to the toilet and cleaning your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. It's important to change your pad frequently. Your vaginal flow will decrease in an amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. You should avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. You should discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Nothing should go into the vagina before the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman and you feel physically and emotionally ready. Some warning signs you want to report to your healthcare provider immediately would include pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision or if the incision begins to open. Discharge from the vagina that has a bad odor, severe headache or blurred vision or other visual changes, temperature over 100.4, or you feel cold, feverish, and have chills. If you have thoughts of harming yourself or your baby, pain or burning sensation, redness, warmth, or swelling in the legs, breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness and red streaks and flu-like symptoms. Sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness or faintness, crying spells, mood swings that feel out of control, unable to empty your bladder or urination that is painful, difficult or too frequent. Difficulty having bowel movements, and you should report domestic violence or abuse. This is the phone number you can call. It's 1-800-96-ABUSE. All right, and now going over some information for your infant. When it comes to sleeping, you want to place your infant on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects like stuffed toys and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not the same bed. Avoid covering the infant's head or overheating. Keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm soapy water after each use, allowed to air dry. Wash your hands before handling the baby. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. The use of outdoor announcements is not recommended to announce the birth because they will call attention to the presence of a new infant in the home. Question any unfamiliar person visiting your home or inquiry about your baby after discharge, and do not let monitors or commercial devices marketed to reduce the risk of SIDS. So when it comes to crying, it's a normal response for your infant to cry. The most likely cause for crying is hunger, the need for a diaper change, or needing to burp. You should burp your baby after each feed. Some calming techniques would include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Some sleep patterns in infants is that they require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tummy time. This will strengthen their neck and abdomen. When it comes to feeding your baby, your infant should breastfeed 8 to 10 times a day per infant cues. Be sure to hold your infant close to you while feeding. Your infant needs to be cuddled, and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting and rubbing their back. When it comes to formula feeding, if you should choose that, your baby is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses a feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. When it comes to positioning them, be sure to hold them close to you while you're feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Infants need to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder and gently pat and rub their back. Some newborn characteristics you might see would be newborn rash. It's normal for your infant to develop this rash on his or her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps, usually on the face, especially the nose, and they'll disappear within the first week of life. Jaundice is a common occurrence in newborns. Your infant may have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow or jaundiced in the next 24 hours, you need to call your healthcare provider immediately. When it comes to caring for your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant soap may be used on your infant's body. Caring for their cord, keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled, and inspect the cord surrounding the skin with diaper changes, and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine each day. Over the next few days, your infant's bowel movements will change from a yellow-green to mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. When it comes to their genitalia, for females, we want to always wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent diaper rash, pat dry, and then put the diaper on. It's normal for baby girls to have a white pinkish discharge. The secretions are normal and they'll gradually disappear. If you have a son and he's uncircumcised, we want to always wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent diaper rash, and pat them dry, and then put the diaper on. For circumcised males, we want to wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent diaper rash, pat dry, and then put the diaper on. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. And the plastic ring method of circumcision does not require a dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad, and plain water. You should dress your infant as you would dress yourself. Avoid overdressing your infant. Too much clothing and too many blankets may cause your baby to become overheated. In terms of vaccines, infants should receive all of the recommended vaccinations. So that is all of the teaching I have for you today. Do you have any questions? No? Thank you so much for joining me.